There needs to be more of a focus and funding on alternative models of care outside of nursing homes. The Greenhouse Project is a nonprofit out of DC that we work quite closely with, and they've been proving out these smaller home models for over 20 years and really advocating for alternative models. There's this newer Einstein option and others who are really fighting for the same thing to say, let's get dollars towards smaller care homes, whether it's through Medicare or whomever. There has to be options that provide that, because in smaller homes, you can have more personalized care when it's done right. It's even been proven about some of the better outcomes and cost savings on the systems when it's done.
I think about locally here, not to get too much into the geography where I am in Southwest Ohio, but we really have a bottleneck in terms of LTACs, in terms of SNFs. LTACs means long-term acute care facility for the sorry about the abbreviations there, but for the listeners. But I really think that it's a tremendous solution, and I don't know what the situation is now. I'm going to inform myself after what it's like in terms of funding here in the state of Ohio for these smaller home solutions like you guys are doing.
Yeah, it's interesting you mentioned that, because as a hospitalist, you're kind of taught that, okay, when someone gets discharged from the hospital, here's what their options are. And obviously our great discharge planners and social workers really dive into the weeds with our patients, but we're taught as the physician, that's really, you go home with home care, you go to a SNF, skilled nursing facility. If they're more complex, like on the US side, LTAC, right? Or there's, typically expensive assisted living options. That's kind of it. No one ever mentioned anything about like these small homes, both in the US or Canada. And my goal is to really, Home Care Hub's goal is to create this really standardized common path to say there is a world you can go to a smaller home and seamless, and it's going to be a great experience. And for us, it's all about choice. People can go to wherever we want. I want to see nursing homes do better. I want to see more home health. It needs to be an all-out approach when we look at the number of beds that we need in the decades ahead. Like, it's just math. Like, it's not even close. Like we have to do something. So, my goal is to create sort of this main path. And even, things like adult day programs. I didn't even know what that was till actually I got back to Canada, and day programs are amazing. Drop off your loved one at 9 a.m, be able to pick them up at 5, and they get programming and socialization. And these alternative paths need to become more mainstream. Yeah, there needs to be more of a focus and funding on alternative models